This is Scott Atlas. Do you know that, right?
Dr. Atlas clearly wouldn't know science if it kicked him in the Atlas.
And they used hypothetical projection models that were so egregiously wrong, far, far off, yet they keep citing those models.
Yes. So Tucker, we know that we don't know the exact number of Ohioans, but what we did know is we assumed community spread already. We don't yet have the exact models that will tell us.
Hey everybody, it's Everett with Ohio for Freedom, ohioforfreedom.com. Who is Dr. Scott Atlas? Why is he such a tremendous addition to the Trump Coronavirus Task Force? Why does the media hate him so bad? And why doesn't Mike DeWine have someone like Dr. Atlas on his team? We're going to break that down. It's really exciting. It's good news, but it's news that's very easy to miss amid all the news that's coming at us so fast and furious. But if you were paying attention, the influence of Dr. Scott Atlas was felt in the president's acceptance speech last night, and so that's what we're going to talk about. Let's get started.
Instead of following the science, Joe Biden wants to inflict a painful shutdown on the entire country. His shutdown would inflict unthinkable and lasting harm on our nation's children, families, and citizens of all backgrounds. The cost of the Biden shutdown would be measured in increased drug overdoses, depression, alcohol addiction, suicides, heart attacks, economic devastation, job loss, and much more. Joe Biden's plan is not a solution to the virus, but rather it's a surrender to the virus.
Folks, that shows you where the president's thinking is. It shows you that he's not just listening to Dr. Fauci and Dr. Birx anymore, if that was ever the case. He is listening to some new voices, and one of those voices is Dr. Atlas. Who's Dr. Atlas? He received his bachelor's degree from University of Illinois, his MD from University of Chicago School of Medicine. He's a senior fellow at the Stanford University Hoover Institution. That's a public policy think tank. That's very important. He was professor in chief of neuroradiology at Stanford University Medical Center. So this guy is no lightweight, but he comes with a different perspective. But you never really heard of him until August 10th. I'd never heard of him until August 10th when President Trump introduced him. We played that clip earlier, and all that had to take place was for President Trump to introduce a new advisor without Tony Fauci on the stage, and the media went all in to hate him. Let's take a look.
Dr. Atlas clearly wouldn't know science if it kicked him in the Atlas.
Now that's Pudgy Brianna Keeler of CNN, which I never watch. But Pudgy Brianna Keeler is not a scientist. She's not a doctor, yet she feels more than qualified to insult Dr. Atlas's credentials, his standing in the scientific community. But she does have some science to back up her criticisms. Take a look at this.
Here's what's really happening in schools according to teachers.
Right now, teachers are scared. Teachers are going out there writing their wills. Personally, I know teachers who are older than I am who are choosing to retire early, teachers who are younger than I am who are changing careers.
I'm just really terrified. If the researchers are wrong, maybe we look silly for a couple months, wearing, masks over our face, but if they're right, we're potentially saving lives.
See, Dr. Atlas doesn't know what he's talking about. Pudgy Brianna Keeler, she knows some scared people, and that's science. And besides that, she's even got some more powerful science, and here it comes.
And studies have found that little kids carry significantly more virus in their nose. Are you familiar with children's noses? Because they're the gift that keeps on giving.
The other criticisms that you'll see will be something like this. This headline, new physician advisor to president more aligned with Trump's views, as though that's bad. Or, from Wikipedia, although prominent as an academic neuroradiologist and policy advisor, Atlas is not a public expert in health or infectious diseases. We'll talk about that. And then this major character assassination, Atlas is a frequent guest on Fox News. That seems to bother them. Why didn't it bother them when Dr. Fauci has appeared on Fox News? Like, I could count at least a couple of dozen times. Kind of hypocritical, isn't it? Okay, so let's get into what it is about Dr. Atlas's viewpoint, his approach that is so different from Tony Fauci, from Dr. Birx, from Amy Acton that we used to have here, from Mike DeWine. And we're going to go to a question by Peter Robinson that was posed to Dr. Atlas 2 months ago on a video from the Hoover Institute. Let's take a look.
That's a horrible finding. But what you're telling me is that you were using data and work that's been around for a long time.
Folks, if you're not familiar with Peter Robinson, that is Peter Robinson really worked up. Peter Robinson is a very calm, thoughtful guy. He works for a think tank, so they sit around and they think about stuff. But what he's about to get into is that Dr. Atlas had co-authored a number of papers based or talking about the effects of the lockdown that were predictable because they were based on empirical data, not computer models, but data and research that has been out there for a long time. In other words, data that we should have been paying attention to at the very beginning of this fiasco.
I assumed that they weren't able to model the costs of locking down as well as they were able to model the benefits, that nobody had done this work yet. Your article, 3 months into the crisis, was the first attempt to measure the costs of the lockdown that I have seen anywhere. Why? Why weren't they measuring the costs from the get-go?
Folks, we're going to let Dr. Atlas answer the question, but this is what this video is all about. At the very beginning of the pandemic, did we as a society really weigh the cost of the lockdowns, the mask mandates, the closing of the schools, essential businesses, and everything else? I believe the answer is no. There was no calculation as to what the real effect on the economy would be, what the medical effects would be, the people that couldn't continue chemotherapy, the people that were too afraid to go to the emergency room when they had a heart attack, when they had a stroke, the hip replacements, the knee replacements, etc. That was never taken into account, and it should have been. Here is Dr. Atlas and his response.
Well, this is really the one of the several egregious failures of the policy implementation here. Because what we would sanely do is consider the impact of what we're doing as well as the impact of what we're trying to prevent. Instead, they did two things. They, the policymakers in general, they put in a lockdown. They didn't care at all. They did not calculate at all the costs of the harms of the lockdown, the consequences of the lockdown. They did a stop COVID-19 at all costs.
Stop COVID-19 at all costs to the exclusion of worrying or being concerned about anything else. I'm just going to insert a hypothetical example. Tried to think of something. This is the best that I could do, but let me just go for it, okay? We got a patient. His name is Jack. Jack is 50 years old. Jack has failed kidneys. His kidneys have failed. He needs a transplant, okay? He needs a transplant, but he's got a couple of complications. Jack is substantially overweight, and Jack has a bad heart, but he needs a kidney transplant. How many medical points of view are necessary to come up with the right direction to move forward with? Is it just from the perspective of the kidney doctor? No, because who's going to do the surgery? I mean, I doubt if the kidney doctor is the surgeon, so you got to consult the surgeon. But that's not all there is. He's got a heart condition. So the heart specialist has got to weigh in there. But he's also overweight, so you've got to take that into account. And so in my silly little hypothetical example, I'm simply trying to point out that you got to weigh different points of view. And when I listen to Fauci, when I listen to Birx, when I listen to DeWine, when I listen to Acton, even though she's gone, they're still on the same track. There's one point of view, and I'm going to bring it home to Ohio. I don't think Mike DeWine cares about the people that die as a result of what he's done. He wants to save lives. What about the lives that have been lost due to Mike DeWine's actions.
Work that's been done on the so-called deaths of despair, particularly in Appalachia, opioid deaths that's related to unemployment. People lose their jobs, the income departs from a town or a region, and alcoholism goes up, opioid abuse goes up, death rates of all kinds go up. That's the work?
Well, actually,
or does it go even farther back than that?
Well, it's partly that, but really most of the stuff that we included in the true healthcare losses were listed in that piece, which are very, very limited list of things. But you're right, the unemployment itself leads to worsening health and loss of lives and life years.
Deaths of despair, loss of life, and life years. Dr. Atlas is going to talk about some medical tragedies that were foreseeable and thereby preventable. We're going to play a couple clips. Listen close.
Again, I'm quoting from that article. In addition to lives lost because of lost income, lives also are lost due to delayed or foregone health care. Explain that, Scott.
Sure. And this is one of the really horrifying but underemphasized truths of the cost of the lockdown. As we said in the article, for instance, 650,000 Americans have cancer and undergo chemotherapy right now, currently. Half of them stopped getting their chemotherapy. And that's just not, that's actually happened in the US during this so-called lockdown. Because it turned out that even emergency care was not getting done. 40% of people who had an acute stroke, you basically have 0 to 6 hours from your symptoms to get into the hospital to get treated. Those 40% of them did not call the ambulance. That's out of fear. Same thing with heart attacks. 50% of people with heart attacks did not call the ambulance. And the most ironic of all was more than half of children did not go in for their vaccinations.
Chemotherapy postponed. Heart attacks not treated. Strokes not treated. That is serious, but listen to this.
And one of my emails recently came from an emergency room doctor at Children's Hospital in Michigan, who told me that the serious child abuse emergency room visits are up 35% during the lockdown. Now, let me tell you what that means. This is very important. Somebody who brings in their child to the emergency room, that's not because they smacked them around and gave them a black eye. These are, and I'm saying this with sadness, these emergency room visits are for children who the parents think they might have killed them. They're unresponsive. They have multiple broken bones. These are the most serious 35% increase in child abuse, and that's directly due to the lockdown, and I'll explain why.
If that doesn't break your heart's not breakable, but I'm sure that it is. And you can probably add to that list, chemotherapy, heart attack, stroke, child abuse from your own personal experience, people that you know, maybe family members that have suffered because of the effects of these mandates and these edicts from on high. I don't remember ever hearing Mike DeWine talk about this stuff. I don't remember ever hearing Tony Fauci talk about this stuff. I don't remember Dr. Acton ever talking about any of this. And yet the things that Dr. Atlas was just talking about are the direct and predictable result of these draconian measures. I'm really glad that he's on President Trump's team. I'm really glad for the way that seems to be informing President Trump's policy now. And if, God forbid, we are ever again faced with a pandemic, the last thing that we need to do is to only listen to the epidemiologists, the virologists, the infectious disease specialists, the Washington medical mafia globalist crowd. No, we need a balance of perspective, and we need to make sure that we do what's right for the broader society. I'm going to play a couple of clips. Dr. Atlas against the conventional view of schools open, schools closed.
Well, Tucker, we've taken some pretty dramatic action. We've closed the schools.
Exactly. So, when you shut schools, you're really, and there's no risk to the children. Again, there's zero risk to the children. You are directly harming children. I don't understand how people who claim to be so focused on children, teachers, teachers' unions. I think it's really outrageous. This will go down as the most heinous misapplication of public policy in modern America.
Well, I'm going to leave it right there, y'all. I am not trying to make a hero out of Dr. Atlas. We don't need more doctors to worship, but this is a smart guy. More importantly, he's bringing a smart and a balanced perspective. I'm glad he's on board. I'm glad that President Trump is listening to him. And so I'm going to play that clip from President Trump to end us on this little episode. But until next time, God bless you. God bless your family. God bless the state of Ohio. And God bless the United States of America.
Instead of following the science, Joe Biden wants to inflict a painful shutdown on the entire country.
So if the scientists say shut it down?
I would shut it down. I would listen to the scientists.
His shutdown would inflict unthinkable and lasting harm on our nation's children, families, and citizens of all backgrounds. The cost of the Biden shutdown would be measured in increased drug overdoses, depression, alcohol addiction, suicides, heart attacks, economic devastation, job loss, and much more. Joe Biden's plan is not a solution to the virus, but rather it's a surrender to the virus.